Hello and welcome. My name is Lori Huckaby from Newport News, Virginia. Today I will be speaking about my research topic titled Dermotricological Therapies May be Beneficial for People with Oncological Aesthetic Needs. This particular case study is a breast cancer patient that received radiotherapy treatment. She is an African American female, age 65 years old. In December of 2020, she was diagnosed with 1 millimeter small cells in both breasts. In February of 2021, she began radiation treatment that lasted for 3.5 weeks. And in September of 2021, we began dermotricological treatments. The case study presents with a known autoimmune condition called Graves' disease, hyperpigmentation of the skin in both breasts, dehydration of both breasts, and loss of skin tone. Apparently, there are no psychosocial emotional conditions due to adverse skin reactions. A more in-depth evaluation by a mental health professional is recommended. Oncological aesthetics, what is it? It is a specialized field that services people who have experienced adverse skin, scalp, and hair reactions due to chemotherapy, radiation therapy, and targeted therapy treatments. Some of the adverse skin reactions that can occur are dehydration, erythema, flakiness in areas, ulcers, fibrosis, and telangiectasis. These are a few general adverse reactions from chemotherapy and radiation. You have flagellate dermatitis, pruritic erythematous linear streaks, different hyperpigmentation patterns, post-chemotherapy alopecia, and folliculitis. In radiation, some of the general reactions are moist desquamation, dry desquamation, and erythema, just to name a few. This slide shows types of cytotoxic chemotherapy drug classes, the drug, and the type of cutaneous toxicity it can cause. For example, we have chelating agents that cause cell death by inhibiting DNA function, such as bolsafan, which can cause hyperpigmentation, mucositis, skin rash, and pruritus. This slide shows how radiation damages DNA and causes cell death, which can result in the loss of the skin barrier function. Incidence rates. Previous studies have shown that more than 70% of patients with malignant tumors undergo radiation therapy at different periods. Up to 95% of the patients experience skin changes from radiation. This slide shows the radiation dermatitis severity score. In panel A shows you the scoring or the grade and the criteria or characteristics that go along with the score. B shows you the digital pictures of the appearance of the various scores from 1.0 to 4.0. So for 1.0 severity, you would see faint diffuse erythema or diffuse hyperpigmentation. For a grade 2.0, you would see definite erythema or hyperpigmentation with fine desquamation and pruritus or itchiness. A grade 3.0, you would see deep red erythema, diffuse desquamation, and some desquamation in sheets. A grade 4.0, you would see violaceous erythema, diffuse desquamation in sheets, patchy crusting, and superficial ulceration. My specific case study would be classified as a 1.5 to 2.0 due to the extreme darkening hyperpigmentation. Psychodermotricological profile. There are no specific psychological factors at this time to suggest whether a patient would experience an adverse skin reaction from radiation therapy or chemotherapy treatments. Although there have been studies on how one perceives oneself based on adverse skin reactions caused by radiation therapy, chemotherapy, and targeted therapy. These were conducted using health-related quality of life and skin-related quality of life questionnaires. My case subject completed 2 assessments, the HADS and the Skindex 29. In the evaluation of the Skindex 29, The subject answered rarely to the questions of whether the skin hurts or itches, sometimes to the question of is the skin sensitive, and never to the rest of the questions. In the HADS assessment, the case subject has not experienced any anxiety or depression. Further evaluation by a mental health care professional is recommended. Current medical treatments in oncological aesthetics. Traditional treatments including topical steroids, creams, ointments, and hydrogel dressings have been widely used in clinics. They have been shown to have considerable therapeutic effects. Innovative treatment of acute radiation-induced skin reactions still needs further studies. Treatment of chronic radiation-induced skin reactions is more difficult. Many advanced treatments such as mesenchyme stem cells, hyperbaric oxygen therapy, and superoxide dismutase and laser therapy are promising. There are still a large number of clinical trials and studies needed to validate its efficacy. Objectives of the evaluation of the case study. General. The objective of this evaluation is to determine whether adverse skin reactions caused by oncological therapies can be treated with dermotricological therapies. Specific. Determine if hyperpigmentation in both breasts can be reduced, determine if the skin tone can be improved in both breasts, and to determine if the flexibility of the skin of both breasts can be improved. The tools that I used for my case study were a Huckaby, which is an assessment tool or micro camera used to take microscopic views and images of the skin, scalp, and hair. And I also used the Skindex 29, which is an assessment tool used to gauge how a person is feeling about themselves and their quality of life as it relates to their condition that they are experiencing. This slide shows before treatment photos to the left and after the first treatment photos to the right. At the bottom here, you see images of the skin before treatment and after the first treatment, and these were taken with the Huckaby micro camera. Here are before pictures. You can see the hyperpigmentation, and in the bottom row of pictures you see where the Huckaby shows dry, cracked skin. Case study treatment objectives. General. The objective of this treatment is to reduce the skin reaction of radiotherapy treatment in both breasts by applying dermotricological therapies. Specific objectives are to reduce hyperpigmentation in both breasts, improve skin tone in both breasts, and increase the flexibility of the skin of both breasts. The in-clinic treatment consisted of normalizing cleansing base, K1 essential oil, because the skin is sensitive and dehydrated, and K1 oil has anti-inflammatory and moisturizing effects. I also used organic peat, collagen, and N-ample all together, and that combination will promote decongestion, oxygenation, firmness, and tone of the breast. I also used the Cappadermia Plus bipolar radiofrequency with Revital. I use Revital because it is effective on dehydrated, aged, and sensitive skin, and the Cappadermia Plus bipolar frequency stimulates the production of collagen and elastin, which improves the quality of the skin. The at-home treatment plan consisted of normalizing cleansing base, collagen, the Pure, Shock, and Revital to be taken in 4-month cycles, and applying K1 and Special K cream at night. This slide shows images after the first treatment. Notice how you see significant decrease in the hyperpigmentation, and the skin doesn't appear to be as dry. Here you can see before dermotricological therapy and after the first dermotricological therapy. Notice the decrease in the hyperpigmentation. The skin quality is improving, and look at the scar on the right breast. It has decreased and is not as noticeable anymore. In conclusion, there is very little documented research to support non-pharmacological therapies in the treatment of adverse skin reactions to chemotherapy, radiotherapy, or targeted therapy treatments. Further research in this area is warranted. This case study is the first of many to come. Comparison of before and after dermotricological therapy shows a significant decrease in hyperpigmentation and an overall improvement in skin quality. The results suggest that dermotricological therapies may be beneficial for those with oncological aesthetic needs. Muchas gracias. Thank you.